Hi, everyone. Welcome to the CONVERGE Virtual Forum on new and proposed research on COVID-19. For those of you who I don't know yet, my name is Lori Peak, and I'm the principal investigator for the NSF-supported CONVERGE initiative, as well as for the SSEER and ISEER networks dedicated to social science and interdisciplinary extreme events research. I also serve as the director of the Natural Hazard Center here at the University of Colorado Boulder. And on behalf of the entire team here at the center, we wanted to begin this forum by acknowledging just how dramatically all of our worlds have shifted in a matter of months. Our hearts go out to the people who have succumbed to COVID-19 and to the hundreds of thousands of others who have fallen gravely ill as a result of this disease. It seems as if no part of our social world has gone untouched by this pandemic, and thus we truly thank all of you for your dedication, support, and willingness to join with us today to talk about new as well as proposed initiatives related to COVID-19. Before proceeding, we did want to acknowledge that this virtual forum is being recorded, and that we will post this recording on the CONVERGE website. Also, please know that there are 370 persons signed up for this virtual forum, and so we do need to ask that everyone please keep your microphones on mute to ensure the sound quality for everyone. The purpose of today's virtual forum is threefold. First, we are going to have an opportunity to learn from NSF program directors, science advisors, and our Natural Hazard Center deputy administrator about recent calls for rapid response research focused on COVID-19. Next, we are going to hear from 17 researchers who have already launched or are soon to launch projects on COVID-19, specifically focused on the social, economic, and behavioral dimensions of this pandemic. Third, any remaining time that we have together today, we will dedicate to sharing resources and to identifying possibilities for effective and ethical coordination and collaboration in this, in the response to this event. It's perhaps never been more clear how much every one of our actions matter and how important it is that we work together to collect and share data and new insights. So thank you again for being here today. Over the next 10 minutes or so, we're going to first hear from Jack Mazzaros, who serves as the Science and Technology Advisor at the National Science Foundation. And then we will hear from Walt Peacock and Bob O'Connor. Walt serves as the Program Director for the Humans, Disasters, and Built Environment Program, while Bob is the Director for the Decision, Risk, and Management Sciences Program. Jack, would you like to go ahead and take it from here?
Me here.
Jack, hi, I can see you and we can hear you.
And you can hear me, great. So I'm going to be very efficient because I want to hear from the researchers. NSF issued on March 4th what we call a Dear Colleague letter, which is an invitation to researchers to consider whether they're doing work pertinent to a topic that is of great national importance in this particular case. So the idea of the Dear Colleague letter is to encourage the research community to remember that if you are doing work that could possibly make a difference in this arena, we're talking about the kind of fundamental research NSF funds, of course, that we're always here to welcome such research. And research that matters to the nation is valued in our broader impacts criterion. So we want our researchers to understand that if you have a regular proposal that belongs somewhere at NSF, you want to highlight the potential value, even if it's not direct, even if you just anticipate that this could be potentially valuable. That's something that will be taken into account during review. We also reminded the community that we have what's called a rapid response research mechanism, such that we can do fast turnaround on short proposals of about 5 pages in instances in which a researcher has identified an opportunity to do work pertinent to, in this case, disaster research, that it hinges on ephemeral data that would either disappear like human memory or degrade like social media information, or access. Say that this is a situation in which, because the community is in such need, they invite researchers in and give access to things we wouldn't normally be able to observe, right? These are special situations in which, if we don't get in there really fast, the data will disappear. Bob O'Connor has already made several rapids in this space. So the opportunity was listed on March 4th, and we can turn things around really quickly if that is what is needed. To submit a rapid, you have to be invited by a program officer. And so you have to send an initial inquiry, and we are fielding hundreds and hundreds and hundreds of inquiries right now and tracking those. We're going to let Congress know how motivated all of you scientists are to make a difference in this nation. We won't be able to fund most of them. A number of them, there's my cat, sorry. A number of them are actually, the number of things are being proposed as rapids. You're being told that's actually a good regular project or possibly a supplement to something that you're already doing. But we're tracking all of it, and we will let the nation know that you all were thinking hard about how you can make a difference. There's a second Dear Colleague letter that was issued by our Office of Advanced Cyber Infrastructure that is specific to data that would, let's see, so things that would relate to Frontera, Stampede 2, Comet, Jetstream. If you know these if these names sound familiar to you, this rapid invitation is for you. These are for projects that are specifically for data development or software infrastructure development. So Lori, I can give you the links to both of those so that our community can consider the potential. And I will just say, I think that data in this situation is of particular interest around the world. If you're watching what the medical research communities are doing, the rate at which they are able to share data, do fast turnaround reviews, nobody's worried about holding on to things until it's published. It's inspiring, and I think it's going to inspire all of us in this community to make progress going forward.
Thank you so much, Jack. And I am sure there are many people on this call who have many questions for you and Bob. And so a question right now, while we have you on the line, would you prefer if people put questions in the chat box, then we can compile them? If people, do you want them to just reach out?
That would be lovely, because if I respond one-on-one to people, then only one person learns. But if we could post responses in that way, we can work on that pretty quickly. I think that's a great idea.
Wonderful. And Katie Murphy, who is on the line, has exceptional expertise at that. And so to all of you out there on the phone line, if you have questions for NSF program directors who are on the line with us, for Jack, please go ahead and put those in the chat box. Know that we'll compile them, and then we'll post the responses up on the COVID-19 CONVERGE website. So thank you very much, Jack, for that overview. Walt, I saw that you're on the line as well. Would you like to share some remarks with the community?
Sure. Can you hear me?
Yes, thank you.
Yeah, I think Jack gave a really good overview of things. Just a couple of points. I personally have not been to bed before like 2:30 in the morning because of all these things as well. NSF, just so y'all know, has basically gone virtual. So we are dispersed ourselves, and so many of us are setting up offices elsewhere and stuff and trying to get things moving and trying to help with our families as well as everything else. So anyway, I'm just saying that. With respect to that, then, I do ask you to kind of go out and target particular programs. Many of y'all know HDBE, Human Disasters in the Built Environment, Bob's program, and there are many other programs as well too. And if you are unsure, rather than sending an email to me, an email to Bob, an email to Jack, an email to, and then we are running around like peacocks with their head cut off, trying to kind of field these things. If you can send that, to all of us, and then, say, I'm not sure what program, that would help us to try to coordinate things. Be persistent as well too. I mean, I have tried to kind of make sure I'm capturing all these, but some are slipping through just simply because of the volume of emails as well too and stuff. So just keep those kinds of issues in mind. With respect to HDBE, it is humans, disasters, and the built environment. So we are looking for topic areas that cover those three. They do not have to cover them, equally, but we are looking for those areas. As Jack said, this is not just get the money out the door. We are trying to fund good science here. So there has to be good science questions, as well as the ephemeral data stuff. And there are many wonderful, important issues that are coming in that simply don't depend upon ephemeral data, that simply don't qualify under the auspices of a rapid. So we will, try to encourage you to kind of think about putting those things in later and unsolicited grants as well too and stuff. So please try to kind of keep that in mind as well too. And as Jack said, we are being inundated. We have no idea what the pool is. It is a limited pool. We're going to try to do the best and fund the best that we can and stuff. So don't be discouraged if we say no. It doesn't necessarily mean it was all bad. It just doesn't fit. Program doesn't fit the nature of a rapid and the like and stuff. So.
Thank you, Walt, so very much. And is Bob O'Connor on the line?
Yes, and I just unmuted myself, and I promise I'll be brief. I just want to say I have told Lori, I'm delighted that you're doing this. I hope it encourages folks to think seriously about, gee, what don't we know that would be good that we know, and we need to find it out as soon as possible. This is a special time. Agree with everything Jack and Walt said. I have a couple of notes from the Social Behavioral and Economic Sciences Directorate. As most of you know, well, there are, just like most things at NSF, there's different policies and customs on different floors. And to do a rapid, you really need to contact your program officer. By your program officer, what I mean is, like if you're dealing with an economic issue related to this situation, and it's something that has ephemeral data, you really gotta go out there and study how people are making economic decisions of some type, I don't know, right now. You need to send a one-pager to the program officers from the economics program saying, look, this is what I want to do. This is the theoretical or methodological advances you're going to get out of it. It's not just a wild fishing expedition. It builds on the literature. What's the literature that you're building on? So send that to an econ program officer, preferably all three even, and they will get back with you shortly. In a number of cases, they'll say, well, we already funded something like that. It seems almost exactly this. So sorry, your luck is bad. Or they say, well, what you're doing is really just descriptive. You need to explain a little bit more. So send us more about what you want to do. A third type of thing they do, which you want to hear, is to say, this is very much on target. Please send us a formal proposal. The proposal is a standard NSF proposal with a couple of exceptions. One, it's for one year of research. The limit is $200,000. And third, the project description is 5 pages. You can say a lot in 5 pages, really. So I don't know what more I can add. We encourage you. I will give you a bit of sad news right now, which is that we have no extra appropriation for this. So this is coming, anything Walt funds of his programs, Human Disasters in the Built Environment, is coming out of his budget. Now he's hoping that somebody will give him a nice infusion at some point, but you know, Walt has a rich fantasy life too. But we do hope this happens. I hope my program, Decision Risk and Management Sciences, Risk Perceptions, Communications, etc., also gets an infusion. Okay, I will stop rambling incoherently. I hope to hear from many of you. Actually, I do and I don't. If it's good, I do. We are inundated. Thank you.
Yeah. Thank you, Bob. And that was highly coherent. And thank you again to Jack, Walt, and Bob for joining us. And again, to those on the line, if you have questions, please continue to put those in the chat box and know that we will compile them. Next, we're going to hear from Jennifer Tobin, the Deputy Administrator of the Natural Hazard Center, about the Quick Response Special Call. Jen?
Hi, everyone out there in our virtual community. First, I would like to say, take a quick moment to say to Jack, Walt, and Bob how very thankful we are for your continued service and dedication to this country and to advancing science during this challenging time. We just so admire and respect the work that you are currently doing, so thank you for that. As already explained, my name is Jennifer Tobin. I'm the Deputy Administrator for the Natural Hazard Center, and I also administer our Quick Response Grant Program. This is a National Science Foundation funded small grants program, and we have been offering these awards for approximately 35 years and have helped researchers to publish over 250 reports on our website, and many of whom have gone on to publish scholarly journals, books, and also received larger grants from NSF as a result of their quick response work. These small grants provide training and funds for researchers to quickly collect perishable data following disasters and other extreme events. Although we accept proposals on a rolling basis year-round, we do often put out special calls for events that result in higher than normal interest from disaster researchers. And to get more information about the program and to be alerted when we open special calls, please sign up for our small grants program communication at hazards.colorado.edu/signup. Thanks for switching my slides. So right now, of course, as you can imagine, many researchers are interested in learning from our current global crisis. Therefore, our team has opened a special call for proposals to examine how COVID-19 is affecting potentially vulnerable or marginalized populations, healthcare workers, and other frontline responders, organizational impacts, and communities in general. Also, studies that are focused on policy response, the economy, and other social consequences in the US and globally are welcomed and encouraged. For those of you interested in submitting a proposal, we have currently have enough funding to offer 3 to 5 awards of up to $3,000 each, and proposals are due by midnight on April 1st. Also, just for those wanting to submit, I've been receiving many inquiries about funding for travel versus non-travel based research. And although we will review and rank all submissions that come in, I want to be clear that we do strongly encourage proposals that do not require travel or in-person contact right now. And if they do, please do take the time to explain how you're going to make sure they are that researchers are being ethical and following current suggested safety guidelines to reduce the spread of COVID-19. And just as a reminder, please read the full submission guidelines prior to submitting your proposal on our center website. And if you have any questions at all, feel free to email me anytime. We're very excited to read all the proposals and learn from this community of dedicated scholars. Your research definitely matters right now, and we thank you for all of your contributions.
Thank you so much, Jennifer, and to all of those out there on the line. If you have questions for Jennifer, please also put those in the chat box and we will be responding to you. So thank you. Now, to everyone who is out there on this virtual forum who have been wondering how this is going to happen, here is how we are now going to proceed. We have identified, and researchers have self-identified to us persons who have already launched projects or are soon to launch projects focused on COVID-19. And so we have 17 researchers who are each going to give a 1 to 2 minute briefing on what it is that they're doing. And we are doing this so we can hopefully bring together, connect the members of the research community and help to elevate these projects that are already happening and to inform future proposed projects. And so we're going to begin now with Nicole Arrett, who is going to kick us off and role model for us how this 1 to 2 minute briefing can be done. And then I will call on each researcher in the order that you're listed as we move through the slides. So Nicole, could you please start us off with your briefing? Thank you.
Thanks, Lori. I'm timing myself. So from following the 2014-2015 Ebola crisis, we wrote an integrative review paper describing the limited evidence on the effectiveness of travel bans as an emerging infectious disease control measure. And serendipitously, this paper happened to be published at the beginning of the COVID-19 outbreak. And I received a lot of questions like, well, if we don't know that they don't work, why don't we just use these travel bans anyway? But as we all as social scientists and socially aware people know that these restrictive public health measures have tremendous consequences. So we recently launched the King County COVID-19 community study, where we are using an online platform to collect ephemeral information about how the pandemic and associated restrictive public health measures are impacting individuals, families, and communities, and similarly how they're adapting and coping in this context. And we've started partnerships now with colleagues across the world to conduct similar studies. We're working on a joint protocol and REDCap data dictionary. So it's a really low-cost way if you're looking to how to collect some data within your own community, and we'd welcome additional collaborations. Briefly, a few other things I'd like to mention is that I chair the National Institute of Environmental Health Sciences Disaster Research Response Working Group, and we're convening an expert panel of environmental health scientists, including those who focus on social and community dimensions of environmental health, to identify and prioritize COVID-19 related environmental health research. If you're interested in self-nominating, please contact me. I'm also serving on the WHO COVID-19 Social Sciences Research Work Group, which is working to implement the WHO COVID-19 Research Roadmap, which Lori has shared with you. I encourage you all to review that document as you develop your own research ideas. The social science piece starts on page 87. And finally, I chair the Earthquake Engineering Research Institute Public Health Working Group. And as many of you know, there was a series of earthquakes in the Salt Lake Valley yesterday. So now is a good time as any to think about how we do disaster research in this context. So we're looking to do some virtual reconnaissance. If you'd like to participate, please contact me. 3 seconds to spare.
Thank you, Nicole, and thank you so much for kicking us off. And 2 things to everyone on the virtual forum. If you want to follow up with the researchers or program directors who you've already heard from, if you go to the CONVERGE website where you registered for this meeting, all of the presenters are listed there and their names are hyperlinked where you can find their contact information and also where you can find these additional resources that researchers are referring to. Jeanette Sutton, I've seen you on the call and you are next up.
From thanks so much. So I'm working with my colleague Carter Butts at the University of California, Irvine, where we're building off of the experience we have from our NSF funding to look at how social media is used for online informal communications. We recently did work on Zika and Ebola, looking at how messages are retransmitted over social media. And so we've suggested doing that again for this particular pandemic, where we are collecting the public health and emergency management and governmental accounts at the local, state, and federal level on Twitter, and we're looking at all of their messages retrospectively and longitudinally, and we're coding the content, the textual content, as well as the visual content, manually automated, and then using machine learning to look at the dimensions of those messages that get amplified in the social network. So our ultimate goal is to help to provide design guidance on how to make those messages go farther. So the social amplification of risk theory is our primary theory that we're drawing from. And because we've done this kind of work previously on other kinds of hazards, we think that applying these particular methods and strategies to this event is going to help to shed additional information for us, especially thinking about how people are socially isolating, and this has a direct impact on the environment that they're in as there's travel travel restrictions, and then the infrastructure is impacted dramatically with all the people who are currently online. That's it.
Thank you, Jeanette. Melissa from RAND, next up, please.
Yeah, hi everyone. Thanks for this opportunity. Let me just say that we have proposed or submitted a proposal to the NSF RAPID program that DRMS has recommended for funding, but we have proceeded at risk. So hopefully we'll acknowledge that the NSF funding soon. This is a project on evolution of public risk perception and mental models regarding COVID-19. Andy Parker is the PI and Katie Carmen and myself are co-PIs. Our research focus is to examine the extent to which mental models of a novel threat like COVID-19 dynamically change in response to changes in the environment, and how this relates to changes in risk perception and risk responses or behavioral responses. For those of you unfamiliar with the idea of mental models, these are intuitive theories made up of related beliefs or perceptions about risk, which may or may not align with scientific consensus. And one of the things that we're doing that's unique or unusual is we're really tracking longitudinally within individuals how these mental models change over time. But our secondary goal is to develop new natural language processing methods to analyze large samples of mental models data, which historically have really been done manually. So we're leveraging some previous work and an initial survey that we got in the field early on COVID risk perception using RAND's American Life panel. This is a large standing internet panel that provides a ready-to-go probability sample of US adults. We have very high retention rates, so the longitudinal design is feasible. We have a very short survey using some free listing items to try and ascertain various aspects of people's mental models, but of course also capturing some cognitive and affective elements of perceived risk, subjective probabilities, worry, self-reported protective behaviors, and attitudes toward different policy options. And then we can combine these new data with existing data that we have from these panelists, of course demographic background data, but also we have fielded surveys previously about Ebola and Zika, H1N1, and are just finishing up avian influenza mental model study with them also. So I think this will be really helpful to inform public health professionals about any gaps or misconceptions in people's mental models and how that changes over time as different information becomes available, different elements of policies are put into place, and that can be directly fed into public health risk communication efforts.
Thank you, Melissa. Eric Kennedy from York University, next up.
Thanks so much for organizing this and pulling it all together. Three quick things from the Canadian end. So I'm leading a project that is doing large-scale longitudinal work tracking social dimensions in Canadian households. We're looking at things like trust, stigmatization, preparedness behaviors, views on government interventions, and the like. That's being fielded out to 150,000 households across the country, and we'll be doing 2-year longitudinal tracking, some with the same folks and some with additional top-ups for demographic reasons. The second piece is that we've been coordinating as much as we can with international partners to try and look at where we can standardize questions and items. At the moment, we have folks in Ireland, Arizona, California, Maryland, New York, and the UK who are using pieces of the survey to allow for international comparison, and potential collaborators in Norway, New Zealand, France, and Germany. Our instrument will be posted to our website shortly, and we are super keen to enable possibility of comparison of international data through standardizing items. As that is launched, our Canadian instrument is in the field this week. The thing we're sort of pivoting and turning to is looking at providing a portal to aggregate a bunch of the survey-based research that's occurring, just to help draw visibility to other people's work. There are so many different polling firms and survey researchers and the like who are doing data collection right now. And so we're working on building a living systematic review of those. That again, I'll put the link in the chat and it's on the website. And so we're looking for, number one, to make a resource that people can visit and check out and see the work that everyone is doing. And number two, a place that people can submit their own work so that it has additional visibility there. Yeah, eager to connect and collaborate internationally.
Thank you, Eric, and thank you for putting those materials up in the chat box. And again, Eric is linked, as are the other researchers on the CONVERGE COVID page. Thank you. Next up, we are going to hear from Carl Kim. Aloha, Carl.
Good morning or good afternoon to you all. Thanks for this opportunity. I posted a short PowerPoint that will cover more of the material in detail, but there are two initiatives that we've launched already. I edit an open access journal called Transportation Research Interdisciplinary Perspectives. It's published by Elsevier, and we put out a call for papers on this. Elsevier is waiving all the open access fees on this, and we are looking for short as well as longer research, and we've gotten a lot of positive response from that. The second thing that I wanted to mention is that I direct a FEMA Homeland Security Center that trains first responders and emergency managers. To date, we've trained more than 50,000 across the US. So we've developed a questionnaire that we distributed early this week, focusing on social distancing, quarantine, isolation, and/or lockdown. And we're looking for policies, programs, procedures, protocol, the specific types of actions that have been taken by different governments. And then what we're really interested in are the thresholds for risk assessment, for triggering the different types of actions. This will be fed into the work that we're doing in terms of identifying gaps and training needs assessments. We've already gotten, since the beginning of the week, about 350 responses to this, in part because we work very closely with many of the people that we're trying to reach out to. Right now, the focus has been on the US. We've been sort of doing this in waves. We started first in our community in Hawaii, extended to the US and the continent. We are planning to go international, and we're having it translated into Chinese, Italian, and other languages as well too. Part of what we're trying to do is to make this data available, to use it to support the ongoing research. I'm willing to share what we come up with. And so that's it. I think that's my time.
Thank you so much, Carl. Next, we're going to have our first of two tag team presentations. And so we're going to hear from Mindy Schoss and then from Chelsea Lenoble. So Mindy, do you want to take it?
Sure. Thank you all for this opportunity. So I am an industrial organizational psychologist by training, and we have a group of us that are currently conducting survey-based studies with a few populations, one of which is working students. So this is a group that typically works in precarious jobs, so low wage, high insecurity types of jobs. So we're looking at how job and financial insecurity, concern about the virus, and the different ways that their employers have responded, how all these things impact a variety of outcomes, including safety-related behaviors, such as going to work sick, as well as general well-being.
Thank you, Mindy. Chelsea?
Hi. So like Mindy said, we're a team of industrial organizational psychologists really interested in the impact of various organizational changes as a response to COVID-19 on employee experiences. And so expanding this out a bit, there's also been unprecedented impacts on the higher education system. So as a secondary study, we're also looking at expanding this model to undergraduate education, so looking at the impacts on faculty and students. We're interested in how universities are communicating their kind of crisis messages to their faculty and students, and then the impacts of the ways that faculty and students interact with or engage with social media on how they're transitioning to online instruction, their feelings of stress, self-efficacy for being able to make that transition, and then some academic outcomes as well, to look at how students feel about this transition. And then kind of the culmination of this is to be able to provide organizations and higher education institutions with recommendations for better supporting their employees and their students in not just this situation now, but ones that might arise in the future.
Thank you, Chelsea, very much. Next, we're going to hear our second dual presentation coming out of York University. And so Ida Mamuji and Jack Rozdilsky, you're next up.
Thank you so much, Lori. So I'm leading a transnational research team exploring social impacts and social countermeasures as it relates to COVID-19. The project is funded by the Government of Canada, the Canadian Institutes of Health Research. Very appreciative of the funding received. So as we know, Chinese communities around the world are facing impacts to their personal well-being and livelihoods by way of discrimination and xenophobia due to COVID-19. We saw this after SARS and we're seeing it now. And so what our project is two-phased. In the first phase, we're going to examine how Chinese diaspora communities in two globalized urban centers that have significant ethnic communities are understanding and reacting to COVID-19. So we'll be focusing on Toronto, Canada, and Nairobi, Kenya. We'll be seeking to understand the extent of the social impact that they're facing, as well as coping capacity and adopted strategies to cope. And then in the second phase of this project, we hope to share what we've learned from the Chinese communities with emergency management and public health officials in Toronto and Kenya, respectively. And we're going to be using participatory-based research approaches to develop culturally specific destigmatization campaigns that we hope to roll out. Our ultimate goal is to see how effective they were in improving community cohesion and to ensure that the targeting of specific ethnic groups does not happen in the next time we have a situation like this. This project is ongoing for 2 years, and more information will soon be available on our website, emforall.com. I'll put that in the chat box. We're looking forward to rolling this out and to the cross-cultural learning and comparison that the methodology facilitates. But as we all know, as the COVID-19 situation evolves, we've had to make significant changes to our methodology. And Professor Jack Rozdilsky, who is also on the team, he's going to address this right now.
Thank you, Dr. Peak, for organizing this meeting, and greetings to colleagues in the United States. This is Jack Rozdilsky, and I'm speaking to you from Toronto, where currently we are under a state of emergency. As Dr. Ramaji suggested, I am one of the co-investigators working on a project working on social countermeasures. But the point I would like to address to the community this afternoon relates to issues. It relates to issues in doing field research in the time of COVID-19. I have 3 points I would like to address in 1 minute, 30 seconds. Point 1, concern. What we are doing here is very important, but I want to stress that nothing we are doing right now is so important that we need to jeopardize the health and safety of others or ourselves. Point number 2 is a caution. From my and our team's experiences and starting research in the last week and a half, qualitative field research in the time of coronavirus is very complicated. If you are starting on or planning to start on research, you will be facing a variety of barriers almost immediately. I am looking at some of the problems associated with doing research in the time of COVID-19, and I plan to make that information available through the CONVERGE project. Point 3, awareness. For colleagues who are starting COVID-19 field research right now, everything from government-imposed emergency measures to closure of university offices is going to be creating a unique number of challenges to you in getting the basic job done of research. The point here is to plan into your research methodology from the start. Flexibility, interruptions, extreme challenges, and unintended consequences. In conclusion, the message here is safety first, and do not make the situation any worse by your research actions. That is the conclusion of my comments. Thank you. Over.
Thank you so much, Jack. Next, we're going to hear from Adam Rose.
Sorry. Hello, everybody. I'm Adam Rose. I'm the new director for the Center of Risk and Economic Analysis of Terrorism Events, or CREATE. That's an ominous sounding title, but we're really an all hazard center. I refer people to our homepage, create.usc.edu, and you'll see a feature story there about research we've done over the last dozen years on various types of health threats. So we've got an interdisciplinary research team of economists. We've collaborated with a lot of decision scientists and risk analysts. This includes Richard John of our psychology department at USC, also external fellows like Robin Dillon Merrill and Paul Slovic. We're just beginning a study sponsored by DHS on the economic impacts of COVID-19. And the first thing we've done is identified major factors that influence the outcome. These range from factors affecting labor force participation, such as death and injury, and also the potential presence of a vaccine, economic supply disruptions along the supply chain, demand factors associated with the implosion of the economy, but also increases in the healthcare provision, behavioral considerations mainly associated with avoidance, and resilience, ways to minimize the business interruption after the coronavirus pandemic has started. So we've developed 6 scenarios. We didn't think it would be prudent to just try to put forth a point estimate, and instead we're putting these scenarios together to come up with a lower bound and upper bound economic impact estimate. We're using previous parameters for our study and updating them with the best available data and feeding them into what we call a computable general equilibrium model, which treats the economy as a set of integrated supply chains and also connects the US with the rest of the world in terms of economic activity. We also have a proposal in the DHS that's going to involve Richard John in doing some survey research on behavioral considerations and people in the USC Schaefer Health Policy Center looking at epidemiological considerations. We're also in discussions with Robin Dillon Merrill about still further types of research, more on the behavioral side on this very important topic. Thank you very much.
Thank you, Adam. Laura Stow from Texas A&M.
Good afternoon, everybody. I'm the Assistant Director at the Center on Disability here at Texas A&M University. And for the last 15 years, I've directed Project RED, Research and Education on Disability and Disaster. The World Health Organization estimates that about 15% of the world's population live with a disability. Relevant to the COVID-19 outbreak, our previous research on other emergencies suggests that people with disability are more likely to encounter barriers to emergency services. They're more likely to develop secondary health conditions, take longer to recover post-emergency, and in some cases, more likely to die. Given the emerging statistics on COVID-19, we see intersectionality in that people, some people with disabilities also have underlying health conditions such as heart or lung conditions. In addition, as people age, they are more likely to acquire a disability. And again, age appears to be associated with mortality due to COVID-19. People with disabilities share struggles experienced by other populations vulnerable to public health emergencies, including poverty, underemployment, limited access to healthcare. And together, these factors suggest to us that people with disabilities and their families will suffer more impact to this emerging situation. Together with a group of researchers from 5 different universities, we're currently focusing on how this unfolding emergency is affecting people with disabilities, particularly with respect to access to social services, attendant care, medical care, and community resources that in better circumstances allow them to live independently in their communities. We're also interested in if people with disabilities but without underlying health conditions, for example, intellectual disabilities or people with visual impairments, are disproportionately experiencing barriers to information and services in relation to COVID-19. Findings from our previous research suggest that barriers of these sorts consistently occur in other disasters. Thank you all.
Thank you, Laura. And this is worth a pause in our researcher updates for a couple of things. One, I know you're all using the chat box very effectively. We'd offered earlier to please use the chat box to put questions in there for NSF program directors and for Jennifer Tobin at the Hazard Center. If you have questions for the researchers, also please use the chat box for that, and know that we will compile those materials and make sure the researchers get those. And also, if you have ideas for working groups similar to what Laura just described with the disability working group that she has already formed and is mobilizing in the space, if you have ideas for other research working groups, please use the chat box for that as well, because we're going to have some additional information through SSEER on that matter. Thank you, Laura. Next, we're going to turn to Janet Yang from SUNY Buffalo.
Good afternoon, everyone. I actually submitted the proposal in February and just got the official award from DRMS from NSF yesterday. So what we're doing is to look at 2 theoretical questions, one based on psychological distance, especially social distance, which is this idea of perceived similarities between the in-group and the out-group. And the second theoretical focus is on the attribution of responsibility. So essentially what we're proposing to do is to conduct a large-scale experimental survey where we use message testing to look at how varied social distance, close or far, and also the mention of attribution of responsibility or not mentioning a specific attribution or responsibility would influence the US public's risk perception related to the COVID-19 outbreak. We're going to evaluate risk perception both in the sense of cognitive evaluation and also including a variety of affective responses to this particular risk. And the outcome variables we're interested in include, first of all, support for US response mechanism, but we also look at a variety of communication behaviors, such as how people process this particular message that they're exposed to, but also their future intention to seek information about this particular topic and sharing this information, both interpersonally and also on social media and other information channels. So I will be contracting EPSOS, which is the formerly known Knowledge Network or GFK panels. We're going to recruit 1,000 US adult participants. And to date, I have already conducted 2 rounds of pilot data collection to ensure the instrument, especially the experimental stimuli, work as intended, and they do, fortunately. And I've also pre-registered this study already. So for anyone who's interested, you can look at more details on the study design itself on preregister.org. And also, given that I've conducted similar work for the 2014 Ebola outbreak, we'll also be looking at a variety of psychological moderating factors such as political ideology, cultural cognition, perspective taking, and compassionate goals, and to look at how those potential individual characteristics might also moderate message effects on people's risk perception. So those are the focus of my project.
Thank you, Janet, and congratulations on receiving the official award notice. Jack Zinda from Cornell University, next up, please.
Okay, am I visible?
Yeah. Yes, you're coming through. Thank you, Jack.
Great.
Okay, so hello everybody, and thanks for the organizers. I'm part of a team at Cornell University doing work on flood risk in upstate New York, and as an accident of timing, there's an interesting opportunity. We were just about to field a mail survey of about 800 households in 2 upstate New York municipalities on flood risk perception and response. Our main research questions concern how different individual and community factors affect flood risk perception, preparedness actions, and receptivity to different risk management interventions. The questionnaire was printed earlier this week and is ready to go. Given that the COVID-19 situation is sure to affect responses, we started a conversation with the implementer about possible changes. We're thinking about adding a set of questions to the questionnaire about COVID-19 risk perception, concern, preparedness actions, and whether a respondent knows anybody who's been affected. These parallel the questions that we're asking about flood risk. And we see this as an opportunity both to get baseline real-time data on risk perception around COVID-19, but also to analyze it together with data on vulnerability and perception and responses to other risks, and test hypotheses about how the different natures of those 2 risks and other things generate different responses. We're collaborating with state agencies, and we have a big outreach component, and so we're hopeful that we can make a useful contribution. There's a substantial cost to reprint and reprogram, just around $3,000, so we'll definitely be applying for the rapid response grant.
Thank you, Jack, and thank you for joining us and bringing that dimension here. Thank you. Okay, everyone, we have about 10 minutes remaining and 4 additional project updates. Thank you for the ways you're using the chat box if you have questions or requests. And we're going to now turn it over to Maury Cohen at the New Jersey Institute of Technology.
All right, great. Lori, can you hear me okay?
Yes, thank you.
Okay, so I've joined the call today as one of the founders and a current member of the management team of something called the Future Earth Knowledge Action Network on systems of sustainable consumption and production. Future Earth overall is a global and transdisciplinary research network focused on the environmental and human dimensions of global change. It's supported by NSF through its involvement with something called the Belmont Forum, which is an international consortium of a few dozen national science funding councils. The Knowledge Action Network, or the CAN, K-A-N, with which I'm affiliated, is devoted to understanding and facilitating sustainable systems scale change of socio-technical systems that enable contemporary provisioning practices, so agro-food systems, mobility systems, industrial systems, energy systems. We operate on a nested basis. We work with scientific communities, international bodies, national and municipal governments, and civil society organizations. We recently published a brief paper outlining how the coronavirus pandemic is simultaneously a public health emergency and a real-time experiment in downsizing the consumer economy, and the opportunities that the latter may create. We're engaged in efforts to identify newly emergent social practices, institutional responses that potentially could be locked in during the post-crisis period to enable more effective progress on meeting things like the Paris Climate Agreement and the UN Sustainable Development Goals. Finally, we're also involved in projects to reframe the narrative that undergirds current conceptions of growth-driven global development, and to formulate strategies that are consistent with designing more environmentally sustainable and globally equitable futures. Anybody who's interested, we'll be hosting our own webinar next Thursday, March 26th. Anybody interested can get in touch with me offline. Thank you, Lori.
Thank you, Maury, and thanks for putting that link to your webinar next week in the chat box. Jane Henrici is next up from George Washington University and the World Bank Haiti.
Thanks, Lori. I am working with Aojie Zhu, who is an international affairs grad student here at George Washington University and who is from Wuhan. So he and I are preparing to conduct mixed methods research virtually with persons quarantined inside the megacity. He's already been reaching out to various contacts there to confirm their general willingness to participate. And our intent is to gain insights into the gendered and otherwise segmented socioeconomic context. Currently, we're submitting the IRB materials for GW's review. We've designed the project to survey between 70 to 80 on their demographic information and attitudes about their general situation. Then we're going to video interview 15 to 20 individuals from targeted groups that we've identified, such as those running deliveries, non-native Wuhan residents, persons with disabilities, and patients of different generations who have survived the infection. We're interested in gaining in-depth descriptions of lives and strategies of adaptation. Basically, the question is, how do people across communities and neighborhoods, differentiated by gender and generation, as well as occupation and disability status, adjust and thrive during a public health disaster that is combined with a government-imposed blockade? And I want to make a quick side statement here that I've had experiences with the challenges of virtual research in other disaster contexts, and I agree with Jack Radilski, I believe, I hope I pronounced that correctly, about that. And Lori and I have been emailing about a possible future CONVERGE discussion. So I think it's a great idea, and I want to thank you again. And Augier and I welcome comments and help. Thank you.
Thank you, Jane. Next, we're going to hear from Alicia Fraser at RTI International. Well, if Alicia is on the line while she's getting on here, we have linked, RTI has already fielded a survey to 1,000 Americans, and on the CONVERGE COVID-19 Virtual Forum website, we have linked to some of their materials. I also, is Christine or Alicia, which one of you will be sharing from RTI?
So, sorry, I was talking on mute, I guess. I unmuted on my phone, but wasn't unmuted on the computer. Sorry about that. So I'm labeled as Christine, but I am Alicia. I used her link to get here. I want to tell you about a survey that we've already conducted. So a group of my fabulous RTI colleagues and I fielded a survey of approximately 1,000 US residents using a probability-based web panel. That occurred February 28th through March 2nd. And it's hard to remember, but you might remember that was the weekend where things really started to heat up here in the US and COVID became a little more prominent in people's minds. That was in fact the weekend where we had our first death in the US. We asked a series of questions about awareness and knowledge of coronavirus, as well as people's attitudes towards and their willingness to do certain mitigation strategies. We also asked an open-end question of what is your single most urgent question about the coronavirus? As you can imagine, we have just a fabulous amount of data to look into. And Lori, as Lori already said, the slides are posted, but I wanted to give you just a couple high-level results. Respondents they accurately identified the risk as being greater for those who are elderly or immunocompromised. That was at 73%, and they perceived the risk to themselves and their families as mostly either very low or low at 51%, or moderate, 27%. 60% indicated that either they strongly disagreed or agreed with the statement, "I am worried about getting the coronavirus." We had a series of true-false statements that were really interesting to look at. People did really understand that all ages and race and ethnicities can be infected, and that was really high, about 90%. 67% correctly indicated that most people infected with coronavirus will not die, and 59% indicated accurately that most people will recover from the infection. What was really nice about having those true-false statements is we also included don't know, and we saw some pretty high percentages of don't know, and that was informative in helping us identify knowledge gaps. Regarding mitigation strategies, people were mostly willing to self-quarantine at home and agreed with school closures for the most part. They were less willing to support closing public places such as churches, restaurants, and malls. And I'll leave you with a couple, like I said, there's a lot of data there, but a couple that are really great data points that are reassuring. Even at that point, just a few weeks ago, respondents were indicating that they were washing their hands more often. That was at 72%, and 52% indicated using more hand sanitizer and sanitizing in general. So there's lots of data here, lots of ways to slice and dice it. So we're still analyzing, and we are also hoping to field the survey again so that we can look at some trends. Thank you.
Thank you, Alicia. And our last briefing today will be from Kimberly Knowles at the University of Alberta.
Okay, can you hear me? Yes.
Yes, thank you.
Okay. So yes, my name is Kim Knowles. I'm a professor in the social and cultural psychology area in the Department of Psychology at the University of Alberta in Canada, Western Canada. And I just want to thank CONVERGE for this opportunity to talk to others about this important topic. Our research is funded by the Canadian Institutes for Health Research, and it's broadly concerned with Chinese Canadians' experiences of discrimination and stigmatization in this current epidemic. So central to these experiences, we suggest, is non-Chinese Canadians' understanding of the risks associated with the virus and cultural dimensions of preventative health practices. So we're in the very early stages of our research program. We expect to launch online surveys next week, beginning of next week. And the first study explores Chinese Canadians' experiences of discrimination before, during, and it's a longitudinal study. So we already have data from research we've been doing with the Chinese Canadian community over the last 5 years. And we'll be looking at how their experience of discrimination has changed in the last couple of months, and then following up over the next year. We'll be looking particularly at what kinds of support Chinese Canadians would like to receive now and in the future. Our second study focuses on non-Chinese Canadians' perceptions of risk associated with virus transmission, and particularly how the messaging of risk might reduce perceived personal and collective threat, and thus lead to less discriminatory responses and practices. And finally, risk perceptions are also related to preventative behavior. So the third study focuses on mask wearing in public as a preventative health practice. This practice is particularly enmeshed in cultural beliefs that are quite different across Chinese and Canadian communities. So this is a potential point of cultural clash. And so we're going to be using a more ethnographic approach as well as survey methods to better understand the cultural attitudes around the practice of mask wearing and its perceived effectiveness, which we hope will go some way to reducing stigmatization of Chinese Canadians and more effective use of face masks in general. And that's it. Thank you. I look forward to the opportunity to collaborate with others, both in Canada and in the United States, if there's interest.
Thank you so much, Kim, and a big virtual and muted round of applause to all of our researchers who presented today. We know that there are many more of you out there who are contemplating launching studies and are thinking about this. We also recognize that we are now at the top of our hour. And so one thing the CONVERGE team would like to request of everyone on this virtual forum, this is the fourth virtual forum that we have run. We've run prior forums after the Ridgecrest earthquakes, the Puerto Rico earthquake sequence, and we're very interested in learning from all of you about how we can do this most effectively to link our research community together, to encourage data sharing, the kinds of collaboration that you've heard about today, the gaps that you're seeing open up, how we can work together to help to fill those. And so again, please continue to use that chat box. We hope that you will reach out out to us at converge.colorado.edu, converge@colorado.edu, our email address. If you have requests for how we can continue to keep this conversation going, if there are resources you're looking for, resources you're looking to share, again, we will be posting those up on the Natural Hazard Center resource pages and also on the Converge COVID-19 webpage. And so I'm gonna, I think, pause there because again, we are at the top of our hour and I wanna respect the time together and also respect that I know so many questions and comments have come in. We will compile those, we'll be posting those on the COVID-19 website, and we will be back in touch very soon with some opportunities that we have in terms of forming these research work groups and in terms of writing some briefing sheets on research gaps. We know that there were many populations and areas we haven't heard about yet, but we know that need to be filled in the research space. So please know that we will be in touch very soon. We're gonna leave this webinar up for a while, and the Converge team, we can absolutely stay on here longer, but did wanna acknowledge we're at the end of our time and wanted to thank our NSF program directors, wanted to thank Jennifer Tobin for joining us. And again, a big thanks to all of the researchers for the work that you're doing. We hope that all of you are taking care of yourselves as you're also working so hard to take care of others during this uncertain time. And please know that you have all of our gratitude. So thank you again for being here today. Thank you.
Thank you.
Thank you.
Thank you, Lori.
Thank you.
Bye, Laurie.
Bye-bye.
Hi, Laurie. This is Kailash.
Fantastic.
Thank you.
Hi, Laurie. This is Kailash from Jaipur in India at 2:30 a.m.
Hi, Ash. Thank you so much for being here. It's a gift to see you. And thank you for getting up so early to be here with us.
That was so valuable, Lori. Thank you so much.
Thank you.
We'll be in touch. I'll get to work tomorrow more on your CDC thing.